we just released a module called Rapid Service Responder. The patients themselves or the visitors themselves can actually scan a QR code with their phone, extract like what is the situation, like is it out of toilet paper, out of, or the faucet's broken or whatever, it doesn't matter, whatever is the problem. And instead of a nurse have to be involved or administrative staff to be involved, it goes directly to the person that probably can resolve it the fastest and the most qualified to do it.
Alan, thank you so much for hopping on today's podcast. I'm excited to speak to you not only about your work at Ancilla Ventures, and also one of the ideas you've brought to life with a ReadyList. I know you're doing some really interesting work there with large hospitals and facilities. So first off, like I mentioned, you built Ancilla Ventures and, or Ancilla for short, as a really like an innovation company that serves multiple industries, not just healthcare. And one of the ideas that you brought to life was ReadyList, or you're wearing the quarter zip today, the ReadyList quarter zip. What sparked the idea for ReadyList, and like how did it grow into a standalone platform that it is today?
Yeah, the idea came from one of our partners back in the day, back in Accenture days, and he kind of reached out to us about an idea he had at a hospital they were actually opening in California. And one of their big missions was to basically have everything kind of in a more electronic way as possible. They had the opportunity to do this across the board, and his focus was mainly operations and facilities. And he was looking for a software that could help out the environmental services department to be able to basically help manage the employees that actually clean and turn over rooms, and doing it in a way that kind of empowered the cleaners themselves to know exactly what they need to be doing and what's expected upon them. And on the flip side, providing the managers and supervisors the ability to have a better visibility of their operations in general. When you don't have something that allows for electronic means of capturing the information and data, it can become challenging, using paper, or if you don't use paper, you use like spreadsheets or any other electronics. But it's very challenging to be able to do this and in a flip of a switch, be able to actually clearly understand how am I doing at this point in time without some type of platform. So he kind of approached us. At that time, we were looking for more opportunities. Like Ancilla was kind of branded to be able to bring entrepreneurs ideas to life. And this was another opportunity that was very interesting for us because we kind of a background with Ancilla of quality metrics, bringing in data from the healthcare system to be able to kind of measure how either the providers or the hospital itself are providing quality of care to the patients. And at the end of the day, this particular product does exactly the same thing. It just does it in a different way. And what I mean by that is most patients, when they come to a room, they get admitted to a room, the expectation from day one is it's clean. It has no infection. It has all the things that you would expect on any area, especially a hospital. And I think patients, right or wrong, take that for granted, and it's not easy to do. So from our standpoint, this just brings a different way of bringing quality of care to our patients. So we're pretty excited about the opportunity.
Yeah, I love that. From the Accenture days, like you said, and I think both of us are former Accenture, employees and consultants. So I love that, and how you literally like brought the idea to life. Like, you heard about this, there was this need, specifically in these environmental services department, which is like an area that people don't know plays a huge role in these hospitals and health systems. Like without them, the facility doesn't run as it should be, right? And so
I think everyone in a hospital plays a huge part in bringing great patient care. And I think I look at it as kind of a three-legged stool. If one of those legs fall off, like environmental services is broken and not working well, it's hard to treat a patient at the level that they deserve.
Yeah, right on. And these environmental services teams, short for EVS, these teams, they're critical for not just the cleanliness of the room, but hospital safety, right? What problems does like the ReadyList, you called it a product or the platform, solve for those teams? And like what makes your approach different from like other existing tools out there? Like a lot of hospitals use big acute EHRs like your Epics, your Oracle Cerners. Like what problems do you solve and like what makes your approach different from those tools?
Yeah. So if we kind of think about the the EHR's main mission is to be able to treat the patient and understand everything, the process, the outcomes of a patient experience. It's meant for the health of the patient. They also have extensions that come out of that other departments like EVS can use, that when a patient is discharged for a given room, they're able to actually submit either a update on their cell phones, letting the cleaners know that this particular room is ready to be cleaned because the patient has been discharged. And that's really helpful because at the end of the day, it's all about trying to ensure that we maximize our hospitals, especially when there's shortage of rooms, that they're being efficient. And so I think that the EHRs do a great job of doing the communication of the discharges, and then also allowing the nurses to understand that a bed or a room is available for a patient.
Hmm.
I think some of the challenges that we've seen that we believe that we solve for is there's a very clear expectations for the cleaner of what. So I have the alert to come to go and clean this room. I've been trained to do a discharge for this room, do a discharge cleans for this room. But I'll be honest, like every room or every unit has different expectations. There's some commonality across all of them, which you leverage, but then there's some uniqueness by unit that each of them have their certain requirements that are different. And to expect the cleaners to go into these discharges, and they literally sometimes, every hospitals we've noticed is a little bit different. Some hospitals have like a discharge team on the EVS side that their goal is to be able to manage and triage all the discharge cleans. And they'll go by unit, across units. Some hospitals set it up where this particular cleaner does the routine daily cleans, and they also do the discharge because they know the units. It all depends on how they want to do it. And I don't know if there's a right or wrong answer of which way to do it. The
Right.
common challenge, though, is the expectation that they're always going to be able to know exactly what to do every single time and do it the right time. It's kind of like one of those checklists that help prevent them from missing the things that is expected of them to clean a room, whether it's a deep discharge clean or just a daily routine clean when the patient's still there. There's still an expectation for the patient that the room's, is disinfected, it's
Right.
clean, and no different like a hotel experience. They want to feel comfortable, and the last thing they want to do is feel uncomfortable of where they're staying, because they probably have already been through some discomfort through whatever why they're there in the first place. They don't want to
Right.
have to be able to worry about the room itself. And I think the tool helps provide the cleaners a realistic expectations of what needs to be done. And then on the flip side, it gives the supervisors the ability to actually understand what is being done at one snapshot of any type of clean, not just the discharge. And then think that's where sometimes have a little bit of a gap there, is they don't always have a complete picture of how is every single room, which ones still need to be addressed, which ones have been addressed. They can only, in most cases, understand the actual discharge part of it.
Interesting. It sounds like with EHRs, like kind of like the communication engine of like, hey, and like notification engine of, hey, this room's been discharged, it's ready, notify the nurse. Whereas like what the work you guys are doing is really giving the whole EVS team, and sometimes you said they even have discharge units or teams embedded in there that
Mm-hmm.
go across units, like give them a complete picture of like all the rooms from the supervisor to the actual like staff like disinfecting the room, the full picture like you said.
Yeah, and the thing is the EHRs, we work with them. So
Mm.
one of the EHRs we work with is, as you stated, they're really good at managing the status of a given room, of whether it should be, it has a patient admitted or it's been discharged. Is it clean? Is it in terms of it related to discharge? And we kind of tap into that communication, and actually we have like APIs that is able to receive communication from the HR and then send back updated statuses from
Right.
ReadyList to ensure that there is synchronous going between the two systems, which is critical.
Right.
We don't have any intention of replacing that, because I think the HR will
Oh
always
yeah.
know the best because they treat the patient.
Yeah, that's what at the end of the day, that's what the attending, the residents, the care teams are looking at, is the EHR data. So it needs to loop back in. That makes a lot of sense. You did mention this earlier. You threw out checklists. I want to get a better understanding of how like ReadyList directly impacts like outcomes and like metrics for the teams. But like, can you give us a sense of some of the things like this? And you had mentioned checklists. I imagine that those are like disinfection checklist. I think part of what we've spoken in the past about is like certifications too, for like supporting with like CHESP, I think is a big area.
Mm-hmm.
And that's CHESS, like certifications for the staff. Like, can you tell us a little bit about how ReadyList like impacts like those things for these teams? Like, what are the tangible things that they get out of it?
Yeah, so depending on the room, and it depends on the hospital as well, but typically we have the workflow of a checklist as what would be expected from start to finish of actually either doing a discharge clean or a routine clean. And it starts from like reviewing the equipment. Is all the equipment and the supplies there that is necessary for this particular room, for this particular unit? And then it does the collection of the garbage or anything that kind of takes out any of the negative waste or anything that's been infected, whether there's blood on the floor or whatever, right? So clean up the area of all the negative stuff that needs to be out of that room, and then go back, do thorough clean, disinfect. And then it also, maximizes good practices of what's expected on those types of things, because all trained EVS staff knows these types of things. Like cleaning does not mean disinfecting, right? Cleaning is cleaning it, making it look good and making it presentable, but it does not mean it's disinfected. So there's that other routine of disinfecting what may look clean. And then there's also overusage of it too. So we try to make sure that it's very clear. And again, cleaners know these things. These are just nice, friendly reminders on things that sometimes fall through the cracks, because there's a lot of expectations and a lot of items in a given clean. I would say on average, there's like, on a daily clean, there's probably like 8 to 12 items that they got to think about, right? Just to clean a room with the patient there. If you think about a discharge clean or a high clean, those could range from like 20 to like 40 items that have to be addressed, if you really want to itemize it down. And expecting them not to miss a few is unrealistic.
Yeah.
Like
Yeah. Human error is going to happen.
human
Yeah.
error. And
Yeah.
what's kind of nice about it is the application itself provides this every single clean for the cleaners to actually review, and it allows them to kind of spot check themselves. So do they like check a box, do something, check a box? No, they know what to do. So what they typically do is they go and do what's necessary. They come back and kind of review. Did I do this? Check, 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 check. And oh shoot, I
Right.
missed that. I better go do that. And then what's the most powerful of all of it is when the supervisor comes back and do an inspection, they literally go through the same checklist and basically mark down, yes, did this get addressed, or no, it didn't. And there's some good byproducts that come from this, right? So you identify your star cleaners. You should
Yeah.
reward them, right? You should make sure they understand how important they are to your team. You identify low performers, and you identify, are they a low performer because they're a bad performer, or a low performer because maybe they're just not understanding a few things, that maybe like 3 items are missed every single time for this. Maybe it's a good coaching moment, because at the end of the day, I this area, and I would say probably any area similar to them, which are out there, it's hard to find great resources. And your best thing you can do is keep what you have and train them up, bring them up, at least give them the chance to prove to you that they are fit for this job. And the only way you can do that is be able to provide them feedback, and you can only provide them feedback based on data. Data is only going to be able to help you understand exactly where are the gaps of their cleans. What you may find out is across the board, there might be many people missing the same task. Well, maybe that task isn't clear enough or needs to be rewritten, or maybe it needs to be like a overall meeting for the group, like, hey, we noticed you've been missing this particular item. What about it, like, do we have to, like, what can we do different to make sure we don't miss it next time? And so you basically are able to tailor your communication to your staff based on the information. So either you make it broad, or sometimes you make it just isolated to a few candidates and not have to have everyone have to listen to these particular instructions if they got it down. So
Yeah. Yeah. And then let it be a surprise. Like I love what you said, by the way, around like best thing to do is keep what you have and train up your team, bring them up and understand what's going wrong and give them feedback, but also not let it be a surprise for your facility, months, a year later when you're getting, charged for hospital acquired infections, like there's penalties for that, or there's penalties for non-compliance. Like, God forbid, I don't know if that happens in this field, but I know in compliance, there's definitely a lot of certifications that the staff needs to follow. Right. I imagine
well, Joint Commission comes in, and it's a big pressure point for this area, and rightly so. I mean, that helps enforce that they have to meet certain protocols, but it's also a stressful point at the same time. Like with our application, frankly, if they use it correctly, it's a very easy experience for them because of the tip of their fingers. They can show reports, they can show history, because a lot of this is looking at historical, what has been captured to prove to me that you just didn't show that you did your best for this week. I want to see data that actually shows you've been doing this routinely for the last 6 months or whatever the time frame is that they are reviewing. So I think, and then they don't have to dig for the information. It's really just available for them to show the Joint Commission, and ends up being a great experience based on the scenario. And it really, a lot of this pressure goes on the whole team, but the directors and managers probably even more so, because if things aren't documented appropriately, they're the ones that have to triage it and have to deal with it. And it's not, and then also, by the way, do your job too. Like, this is on top of your day-to-day expectations. So
yeah, I like where you were headed with the Joint Commission, like coming in and like, hey, I want to, or you're throwing out the example, I want to see the last 6 months. Have there been any like success stories or wins that you've heard of when like that happens for a facility? You don't need to like name the facility, obviously, but like where their Joint Commission, like the Joint Commission comes in and ReadyList helped them. Like they were able to pull up a report easily, or show like, or answer a question of non-compliance, or pull. Have there been any of those success stories that you've come across already?
Oh, 100, yeah, 100%. Yeah. Any of the clients that go through this, especially if they're on the newer side, definitely, I don't know, they can breathe, and they do communicate back to us saying like, this has been invaluable to us to be able to go through these
Nice.
experiences. And it helps validate that, this offering is definitely more than just the day-to-day stuff that brings value. It's these one-offs that have very high stress points that makes them feel better about it.
It sounds like it could. I mean, these evaluations can kind of come around like whenever. They're kind of like sporadic, and like having ReadyList allows them to have a system to reference off, and like and look at historical data or look at current data. I was gonna say safety net. That's something to check, or a sanity check off. No pun intended. There you go. That's like a
Yeah.
good sanity check.
Yeah, because most of these hospitals, they have some documentation. There's no question about it, but it's typically documented on paper. Some of the things that are critical. And then they got to dig through their paper logs to kind of figure out and produce these reports, which take time. It
Wow.
could range from like an hour to 8 hours to a few days, depending on how big the hospital is. The bigger the hospital, the bigger the challenge it will be. And from our standpoint, whether you're a 150 bed or a 500 bed, you're going to get this information in less than a minute.
Yeah.
So the bigger the hospital, the bigger the benefit.
Yeah, yeah, spot on. And I want to talk to you about some of maybe those challenges that you've seen, because like this makes a lot of sense, and I think there's a clear market for this, EVS teams, hospitals and facilities. But what challenges have you faced with bringing ReadyList to the market? Is it around like just being digital, like having these logs like digitally? Is it like IT buy-in? Is it team capacity? Is it like our classic budget cycles that impact everyone?
It's typically, it could be a budget thing, or it's a maybe not clear understanding of the value of which we've been trying to work on the last year or so, is having people understand that we're not competing with an EHR. The EHR, it does amazing stuff as it relates to managing patient care. And I do think they do a great job communication of a given room for discharge. But if they have the pain points that I described already, the system we have for ReadyList definitely eases those pain points dramatically. But I think it's really just getting that buy-in of feeling that pain enough to realize that this will actually, or in some ways believe that it's actually
Yeah,
real. Like, is this really going to solve my problem? And we have
yeah,
enough testimonial hospitals to share that no, it really does. Even if you wanted to try it out for the 3 months, and the key thing is you have to ensure that your staff is using it diligently. And
ah,
if you don't have enough buy-in from the top down to ensure that people are using the tool, well, then it isn't going to be useful. And I would probably recommend you don't use it, because you will probably look at it as a tool that's not useful. And the reality is you're only going to get as much out of the tool as you put into it. So if you don't
yeah,
put much into it, you're not going to get a lot out of it, and you probably shouldn't get a tool like ours or anything like
right,
this.
right, right.
So we when we work with prospects, we want to make sure that those are interested truly have the appropriate buy-in, and they're in, like they're really
Yeah,
going to get into it, and then they'll maximize all the benefits.
yeah, yeah, spot on. Yeah, I think you and I, as former consultants, know that best. Like, no technology is good without the right process and the right people around it. Like they need to have buy-in, like you're saying, from the top for the tool and be able to use it routinely for it to make sense for them. And out of curiosity, two metrics, like hard numbers, if you have them, or approximate numbers, like how many units on average like use a tool like ReadyList at like a facility, and how long does like a room take on average to be like fully, I know you said it's not just cleaning, like disinfected, ready for the next patient? Do you have any data around those two?
Depending on the unit, right? So
Yeah.
we had a conversation yesterday with a client that in one of their hospitals that they used to be in, it used to take like an hour or so to do a discharge clean or a high clean. That, a high clean is even deeper than a discharge clean, because it relates to maybe an episode of high amount of infection, it contaminated enough that is more than a reasonable discharge clean. So like a discharge they were referencing would take them an hour or so to do like an average room, and then like a high clean could take like an hour and a half or maybe an hour and 45 minutes. And when they started to leverage our tool, it actually dropped it down 15 minutes for a discharge clean,
Wow.
and for a high clean almost 30 minutes. And I think a lot of it was understanding the expectations of what is expected from them in these given rooms. So they're not doing more or less than what's expected, right? And I think that that's like the key message, because overusage isn't good either. So underuse isn't good. It's that medium balance, the balance between the two, that I think ReadyList provides to the cleaners, and gives them that pure expectation. And
Yeah.
and then just again, it just all becomes like a learning curve at that point, and then they become more efficient. And
Yeah.
the other thing to consider is no one typically accounts for the time of rework. So if an inspection comes in there and they miss some things, well, add on more time for the supervisor's time, and then potentially the cleaner's time if the supervisor requests the cleaner come back and fix the things that were not
Wow.
addressed. So those are the other things that are typically resolved, or at least it's minimized more because of these checklists.
that was a very powerful case study around like say how ReadyList has been able to save. You said it dropped at 15 minutes for a discharge clean and almost 30 minutes for a high clean, which is, I mean, you multiply that by multiple rooms in a unit, and you're talking hours of savings, in days if you multiply that by months, right? So these are big numbers, and
And I
like you
look
said,
at like
rework.
OR as an example, right? So like, and I don't like to look at hospitals as a profit center because, their intentions are to be treating the patients.
No, yeah,
But the
yeah,
reality is that hospitals are expensive to run. So if you're able to get another surgery in, that is impactful for a hospital, right? Or if
yeah,
you're able to, discharge and admit patients a little bit faster and still give the same, if not better quality of service, those are good items to help, I don't want to call it profit your
yeah.
hospital,
The
but
patient experience is what it comes
yeah,
down to. Yeah,
yeah,
yeah, like you're able to. Yeah, because like I remember hearing these stories like when my late grandmother was like at Cleveland Clinic in Florida and like just moving rooms for her. Sometimes like a unit would be overfilled and she's waiting for a room, and like it doesn't, like there's an element of it of that, yes, like the hospital could be incentivized to fill the room as fast as possible, but also like some patients literally need a room and they're put in another unit, because the unit they should be in is filled, like
yeah. No,
so.
you're spot on. I mean, I've
Yeah,
seen it when we do implementation. Sometimes the patients are sitting in the hallway waiting to get a
yeah,
room, and to your point, that doesn't probably make them feel great. And it
yeah,
is what it is. But if we can like minimize those, like that's even better, right? I mean,
yeah.
everyone wins. The hospital wins, and so does the patient.
Yeah, yeah. God forbid they're in that hallway submitting their complaint, or I'm like, I'm waiting. Here I am waiting for a room. This is the third time this has happened. Like,
Yeah.
yeah, Alan, what's next for ReadyList, and how can hospitals or other potential partners get involved?
Yeah, what we're trying to do, and again, focusing on the facility environmental services side, is let the data try to instruct the cleaners with feedback based on what they're seeing. So what I mean by that is instead of like having the supervisor be the middle between the cleaner doing the right thing and them going on to the next instructions, is we kind of want to have the data kind of instruct the cleaner based on best practices and minimize the unnecessariness of having the supervisor be involved, because the supervisors are typically spread thin and they really should be focusing on the 20% of the problems that are really meaningful, and then we should be empowering the cleaners to be able to be more accountable and be able to do their job better with some guidance. So we want to kind of help advance our tools to be able to provide more accountability and empower the cleaners to be able to do things more by
Yeah,
getting feedback directly from the tool itself. So we kind of did that a little bit already with a product we just released, a module called Rapid Service Responder, where the goal there is to be able to have the common areas like restrooms, utility, anything that whether the patient or the visitor has to use, and typically it's the restroom or like maybe it's the area that they walk in, where if there is a issue with the restroom or there's an issue in the common area where
yeah,
they walk in, the patients themselves or the visitors themselves can actually scan a QR code with their phone, extract like what is the situation, like is it out of toilet
nice.
paper, out of or the faucet's broken or whatever, it doesn't
Yeah,
matter,
yeah,
whatever is the problem. And instead of a nurse have to be involved or administrative staff to be involved, or even of which typically then they would go to the supervisor after those people are involved, and the supervisor then eventually would either address it themselves or find a person on their staff that could address it. It
yeah,
bypasses all that. It goes directly to the person that probably can resolve it the fastest and the most qualified to do it. It finds the person that's near that situation, tells them what the problem is, and they go and address it right away. The supervisor has the visibility of a dashboard to know that this is happening, and
yeah,
so at least they're aware. but they don't have to be like the middle person to prevent this from happening and address as quickly as
Yeah, yeah.
possible.
This actually happened to me with my mother like last summer when we were in Chicago. We went to like, not to call them out, but like the Northwestern Hospital in downtown Chicago, and like there was a massive spill in like the ER lobby where none of the patients could even sit. Like they had to move the chairs, and like it would have been nice to like scan something and notify them, but they're so slammed that at the moment that was the last thing of their concern. They're just trying to get as many patients triaged and into the ER. But
That's a huge example. I
yeah,
mean, ER probably the one of the busier departments without question,
yeah,
especially depending on where that hospital is. You're right. They're going to focus more on trying to make sure they can kind of manage the patient and treat them as fast as possible. They don't always have the time to triage a spill. So we're empowering the patients or visitors to help
yeah,
themselves in some ways get addressed, and they don't have to bother those other individuals, taking away their job of treating a patient when it comes down to it.
yeah, yeah. Right on. I mean, it comes back to the patient experience, kind of like what I was alluding to. Like this. Yes, it's like the end users are cleaners, the disinfector, the supervisors, right? The EVS team, but like this directly impacts the patient experience for these hospitals and facilities. Like the more efficient you get at this, the better the experience becomes for that next patient or the next one that walks into the doors of your facility, right? Like, or as
Yep.
admitted, right? Yeah. So how can teams like find you online, or like EVS teams and others listening and engage with you guys?
Yeah, if they want to search for me on LinkedIn, Alan Cooper, that's typically, and we'll give you a link on what that is. Or if they just want to go to ReadyList.com, that's a website where we kind of have some of our modules. And I have a calendar invites on each of those things. Or if you ever want to book a meeting to kind of learn more, I'm excited to always meet people. I'm trying to do, like, we're also going to AHE conference out in Columbus, Ohio on June 8th through the 11th. And we're excited to kind of be able to have face to face with those that we believe can really benefit from at least learning from us, whether they work with us or not. It's always
Yeah.
good for us to learn from them, and then maybe we can give something back to them as well. So
Yeah. 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 Spot on. Well, Alan, it was a pleasure having you on the podcast today. You service a very specific but important niche of hospitals and health systems, and really excited to see your guys' journey and your support of these teams. And it's a very important part of making sure these facilities run not just correctly but on time, and again support the patient experience. So, a big fan of your guys' work, and thanks for making some time here today.
yeah, I appreciate you having me on. This was great.